For over 40 years, beta blockers have been a mainstay after heart attacks, prescribed to slow the heart and reduce its workload. The idea was simple: let the heart rest, prevent complications, and save lives. This practice was based on studies from a time when heart attack treatments were far less advanced. Back then, beta blockers helped prevent dangerous rhythms and further attacks in patients with significant heart damage. But today, rapid interventions like angioplasty mean many patients have minimal heart damage and normal heart function after a heart attack. This shift raised a crucial question. Do beta blockers still help these patients, or are we exposing them to side effects for no real benefit? Fatigue, dizziness, and sexual dysfunction are common complaints. The medical community began to wonder if it was time to re-examine this decades-old habit. Modern science was ready to put beta blockers to the test. Enter the Reboot trial, a massive, independent study across Spain and Italy. Over 8,500 patients with uncomplicated heart attacks and normal heart function were enrolled. Half received beta blockers, half did not. Researchers tracked them for nearly 4 years, monitoring for death, repeat heart attacks, or heart failure. The goal: see if beta blockers still offered protection in the modern era. The trial's size and independence ensured reliable results. The medical world watched closely, knowing the findings could reshape care for millions. Would beta blockers prove essential, or had their time passed? The results, presented at a major cardiology conference, promised to settle the debate. The stage was set for a major shift in heart attack treatment. The Reboot trial results were clear. Beta blockers offered no added protection for most patients with uncomplicated heart attacks and normal heart function. Rates of death, repeat heart attacks, and heart failure were nearly identical whether patients took beta blockers or not. The long-standing belief in their benefit for this group was overturned. Millions may have been exposed to side effects without real gain. This challenges decades of routine prescribing and calls for a major rethink in post-heart attack care. Medicine must evolve. What worked in the past may not be needed today. For many, this means freedom from unnecessary medication and its burdensome side effects. The findings support a more personalized approach, moving away from one-size-fits-all treatment. Patients and doctors now have strong evidence to guide better, safer decisions. The era of automatic beta blocker prescriptions for all heart attack survivors is ending. A deeper look at the Reboot data revealed something even more concerning for women. In women with completely normal heart function, beta blockers weren't just unhelpful. They were potentially harmful. These women faced a higher risk of death compared to those who didn't take the drug. This risk was not seen in men, highlighting a critical sex difference. The finding exposes the danger of assuming treatments work the same for everyone. It's a wake-up call. Clinical research must always consider sex-specific effects. For women, this means a serious conversation with their doctor about the risks of beta blockers. The evidence now suggests that for many women, the risks outweigh any possible benefit. Clinical guidelines will need urgent revision to protect female patients. The Reboot trial is set to transform heart attack care worldwide. Automatic beta blocker prescriptions are giving way to a more thoughtful, individualized approach. Most patients with uncomplicated heart attacks can avoid unnecessary side effects without added risk. For those with heart failure or weakened hearts, beta blockers remain vital. The key is a personalized discussion with your doctor. Never stop medication on your own. Ask, given the Reboot results, is a beta blocker right for me? This is evidence-based medicine in action, refining care for better outcomes. Science moves forward by questioning old habits and focusing on what truly helps patients. The future of heart attack care is more precise, safer, and centered on each individual's needs.